Hello all, and welcome to another concussion education session. As a standard disclaimer, this is not medical advice. Our meetings aren't confidential, and we record when we do have group meetings. This is me. There's a picture of me, but you can see me in the upper right corner, or maybe upper left, depending on how you're looking at a screen. When it comes to guests, friends and colleagues are welcome. Family members are welcome. Anyone you'd like. Now, I'm going to move myself a little bit smaller here. And what we're going to talk about for the remainder of this is surface orientation and all things related to it. So I'm going to give background information. I'm going to go over specific surface orientation. And then we're going to finish off with a discussion. Now, this is our pyramid treatment plan. And what we are focusing on is the base of the pyramid, and specifically that surface orientation, which will fall under stress reduction and or mindfulness, depending on what you consider. What we talk about with regards to background information is that autonomic nervous system. Autonomic is automatic. And we're looking at this image here. We have big words, parasympathetic and sympathetic. Basically, what we're trying to say is our calm or our fight or flight. Often, we've heard this one, fight or flight. This one I find is not often discussed, and that's our parasympathetic, our autonomic nervous system, this parasympathetic branch, which is involved for calming, otherwise referred to as rest and digest. You don't need to memorize all these things. I just highlight them in this image because we see when we talk about resting, digesting, or calming the nervous system, it's doing a whole lot of things to our internal organs that we often don't think about. So when I say let's breathe to relax, it might relax the mind, but I care a lot about the autonomic nervous system being relaxed. So what is surface orientation? Surface orientation, supine. Supine just means on your back. If you have worked with us and you have been given one of our treatment booklets, you will remember this image where it gives some specific directions. Lie flat on a firm surface, such as your bed or floor. Breathe deeply and relax. Concentrate on the sensation of your body lying quietly on the bed, and you are not moving. Do this for 5 to 10 seconds. Close your eyes for 5 seconds. Again, concentrate, on the sensation of your body against the surface. You are not moving. So this is a very common tool used when someone is suffering from dizziness, but we often like to add it in as a mindfulness routine to help you fall asleep at night, or say there's a period of significant cognitive stress. Then, of course, we can use this as well as a tool to help us relax. Now, when it talks about lie flat on a firm surface, such as your bed or on the floor, I would probably recommend bed, and I would probably recommend somewhere like your couch or somewhere like a really comfy chair so you're soft and comfortable here. When we talk about 5 to 10 seconds, we're going to think of this as our breath cycle. And from all the other videos you've seen from me and our clinic, we talk about slow breath, slow exhales, really exaggerating and controlling our breath. So not the hyperventilation, but really slow. So if you're breathing slow enough that your breath cycles are beyond that 10 seconds, that's no issue at all. Now, how we're going to do things a little differently today is I'm going to ask you to actually get comfortable and participate. This will take approximately 5 minutes. Pause me right now, lay down, sit in a comfy chair, do whatever you need to get comfortable, and make sure you're safe so that way you can close your eyes and just listen to me. All right, assuming you're comfortable, I'm going to get you to get into a slow breath rate. So we're going to go through the surface orientation guided by yours truly. Nice slow inhale, slow exhale. Into the nose, out to the mouth, If you are well practiced, then you may be able to breathe through your nose as well. So into the nose, out to the nose. The nose is a bit more difficult to control how slow you exhale. Now we're going to do just the upper body today. So with this inhale, I want you to feel the breath moving through your nose, moving through your throat, and expanding your lungs. And exhale slowly, letting everything contract. Diaphragm relaxes, chest shrinks. Inhale again, feeling the air move through your nose, through your throat, into your lungs, and expanding. And exhale really slow. As a reminder, you can do this with eyes open or with eyes closed. And if you're trying to fall asleep, then do this with eyes closed. Now with this inhale, I want you to bring awareness to your neck. Inhale. Move the air through your nose, into your throat, and feel your neck. Does it have tension? Is it relaxed? Is it weightless? Maybe it's warm. Maybe it's cold. This entire practice contains no judgment, only awareness. We're going to feel all the sensations we feel in our neck. We'll do this for a couple breaths here. At your own pace, at your own slow, controlled pace. On the next exhale, I want you to breathe a little bit tougher out, a little bit more forceful. And then we're going to really expand into the nose, feeling that air move through our throat. And we're going to feel that air, that awareness move into our right shoulder. And we're going to go through the same sensations. Does our shoulder feel tense? Does it feel relaxed? Maybe it's a little sore. Maybe it's less sore than usual. Can you feel fabric on your shoulder? Can you feel the seams if you have a shirt on? Or can you feel cloth? Maybe you're covered in a blanket, staying nice and warm, and you feel the sensation of warmth. I'm going to go another breath cycle here. And with the next inhale, I want you to move down to your right elbow. So we're inhaling, feeling the sensation of the air move through our nose, through our throat, bringing that awareness as if we're breathing air directly into our right elbow. And feeling the sensation. We'll go through the same checklist. Is it tension? Is it relaxation? Do you feel gravity? Do you feel weightless? Is it resting against your couch, your bed, your chair? Or is it floating in the air? We'll go for another breath cycle here. And with the next inhale, we're going to move down to our wrist. Inhaling, feeling the nose, feeling the throat, feeling your neck, feeling your right shoulder, your right elbow, and down to the wrist. Maybe you're right-handed and you're feeling more tension here than usual. Feel how your hands resting, palm up, palm down. Does it feel weightless, tensionless? Is there warmth? Is there cold? Acknowledge all the sensations. Now, the next bit of breath work we're going to do together. We're going to be using our fingers. I want you to have your hands relaxed wherever it may be comfortable, maybe on your chest, maybe stomach, maybe chair, armrest. And what we're going to do, I'm going to hold my hand up in case you'd like to see, is when you inhale, you're going to raise it up, engaging your thumb, raising. Exhale, let it fall down. Inhale, move to your second finger, your pointer finger. Inhale, raise. Exhale, let it drop. Inhale, raise up your middle finger. Exhale, letting it drop. Inhale, raise your fourth finger. Exhale, let it drop. Inhale, raise up your pinky. Exhale, let it drop. On this last inhale, create tension. Create tension in all your fingers. Squeeze, squeeze for an extra second. Squeeze as hard as you can. And as you exhale, release all the tension from your hand. Let it feel free. Let it feel weightless. Let it feel as if gravity had stopped working. Your hand is free from all the tension it felt in the day. It's completely relaxed. We're going to bring some awareness back to our nose, in through our nose, out through our mouth. And again, if you're well practiced, into the nose and out through the nose. Nice and slow. And drawing that awareness into the nose, into your throat, feeling your neck, now feeling your left shoulder. Bringing that awareness to your left shoulder. I'm going to do a couple breath cycles here. You can do a compare and contrast. You feel more tension, less tension. You feel colder, warmer. Maybe the fabric feels a little softer on the left side than it does on the right. And again, there is no judgment. There is only awareness in today's session. On the next inhale, we're going to move down to our left inhale. Feeling the air move through your nose, through your throat, and guiding it down through your neck, through your left shoulder, into your left elbow. And bringing that same level of awareness. Is it resting against your body? Is it resting against an object? Is it pressed against something? Does it feel comfortable? On this next inhale, we're going to move down to our left wrist. Inhaling through your nose, through your throat, feeling it in the neck, bringing awareness to your left shoulder, left elbow, and down to the left wrist. And we compare and contrast. Maybe if you're left-handed, this is the more tense hand. Or maybe if you do a lot of left-handed related activity or work, maybe it feels more tense than the right. Or maybe it doesn't. And that's no issue because we're just having awareness today. I'm going to do the same guidance and video with my fingers. I want you to follow along. Resting your hand wherever is most comfortable. Palm will be down. As we inhale, we're going to raise our thumb up. Exhale. Inhale, raise the second finger. Exhale, slowly letting it drop, controlling it. Inhale, third finger raising. Exhale, letting it drop down. Inhale, fourth finger raising, just your ring finger. Exhale, letting it drop down. Inhale, pinky finger raises. And exhale, letting it drop. And on this next breath, we're going to inhale and create as much tension as we can in our left hand. Create tension however feels comfortable. Tense, tense, tense. Inhale. Take an extra little inhale, more tension. And as we exhale, we release tension, we release gravity. Our hand is weightless, feels free and relaxed. And from this point on, we may continue down to the legs, but for today's session, we're going to stop here. I want to appreciate everyone participating in that with me. Questions, as always, can be directly to me, can be to other members of our group, or to our team. As a discussion, How did you feel with the surface orientation, the body scan, or is there other mindfulness routines that you participate in or you've learned about that you'd like to share? Have you tried the 9-minute walkthrough on our YouTube playlist? Ideally, if you're watching this video, you are already aware of our YouTube playlist. And if you aren't, I hope you are now. And we end off. Do you have any recommendations? Have you heard the 9-minute walkthrough video? How would you compare it to how I do things? Is there a video that you regularly watch that you think is wonderful and would like to share? We would all be appreciative of that. As always, summary today was just our surface orientation. I would appreciate if everyone follows our socials. And if you have any questions, you can email directly. Thanks so much. I appreciate everyone.